So certainly we found that there was an increased use of antimicrobials and a broad range of antimicrobials used, particularly in the first wave of the pandemic. And in a study that we published in JACC AMR in 2020, we found that the bulk of patients with COVID-19 did not have bacterial co-infection, but we found that most of those patients received antimicrobials for a time of about 7 days. The main driver for that seemed to be oxygenation. So the longer someone received oxygen therapy, the longer they received antibiotics. The two things that we could have done better, certainly during the first wave of the pandemic, was firstly had antimicrobial stewardship at the forefront of our minds. Secondly, we should be sending more things like cultures, like urine cultures, blood cultures, and pneumococcal antigens, things like those to help identify people that truly do have infection and be stopping antibiotics and those that don't. In terms of mitigation strategies, I think adopting novel technologies is really a useful thing going into the future. Certainly our AMS teams in the hospitals that I've worked in recently have adapted to do entirely virtual rounds using electronic patient records to make recommendations for the primary teams to adjust or stop antimicrobials. Okay, so for healthcare professionals, there's a few key words that I'd like to highlight. Number one is believe. So believe in antimicrobials. Certainly if you have an infection where, say, like an E. coli, urosepsis, and we know that it's susceptible to amoxicillin, for those teams to de-escalate those antimicrobials to the appropriate one. They do work. Second is to listen to your antimicrobial stewardship pharmacists and teams. They love antimicrobials. They do this all the time. So listen to them. And if they make a recommendation, follow it. And finally, be brave in stopping antibiotics when they're not appropriate or when someone's completed the appropriate duration. And then finally, for the general public, I think it's to really use any opportunity you can to highlight that antibiotics are a different type of medication to others, that the more we use them, the less effective they become in other people.